Ultimately, the driving force for all of my practice has been my patients. Whether it's been in research or in direct care or in the indirect care that I do as a clinical nurse specialist, helping with establishing policies and standards, making sure that patients' care is the best we can deliver. My mother and my grandmother are both nurses, and I decided that I wanted to know more about what they knew. I wanted the key to the lock that told me more about how the body worked. So starting in 1980, when I started my career in the surgical intensive care unit here at the University of Minnesota Hospital and Clinic, we were only 2 years into the heart transplant world. We've just watched an explosion of the ability to treat cardiac disease effectively. So beginning in 1995, a nurse colleague and I, working with our surgeons and cardiologists, began our mechanical circulatory support program here at the University of Minnesota. We now have over 800 pumps implanted in patients, and I continue to be involved in that program. What I have been interested in now for some years, and what my doctoral research was based on, was the care of family caregivers. So as much as I'm talking about the treatment and management of patients, we know that they're part of a larger milieu. So it's not just the patient by themselves, but rather the patient engaged with their family and the family engaged with the patient. One of the things that I worry about is the stress on the caregiver, what interventions might be available to actually support caregivers. I think we'll continue to struggle and actually strive to engage our patients in their own care. Prevention is really the solution, not treatment. So we really need to make sure that we have educated our patients and their families, and we've empowered them to actually use the information they have to make their lives better. As much as I as an individual am being honored, this is really not about me, but it's about all the people that surround me. It's about my patients, it's about my patients' families, it's about my colleagues in work, it's about my family, because I think that you can't be successful and effective in your work if you don't have the support of all those other people.